Hey guys, I'm gonna be sharing what I learned about Noonan syndrome today, also known as male Turner syndrome, abbreviated as NS. And Noonan syndrome is a genetic disorder that's usually identified almost immediately after birth by a set of physical features. And it only occurs between every 1 in 1,000 to 1 in 20,000 live births. It usually can be identified by a set of facial deformities and a broad neck and short stature. So, a little bit about the history of Noonan syndrome. It was discovered by Jacqueline Noonan, a practicing cardiologist at the University of Iowa. And she was there studying people with a cardiac defect known as valvular pulmonary stenosis. And after studying 833 patients, she started piecing together that people with valvular pulmonary stenosis were displaying a set of physical abnormalities. And she discovered that she started thinking that the pattern couldn't be just coincidental. And she first wrote about this in a paper she published in 1963 titled Associated Non Cardiac Malformations in Children with Congenital Heart Disease. And so it wasn't officially recognized as a unique disease until 1971. And we'll talk a little bit later about why. But the biggest reason was because it has such similar like physical features as Turner syndrome that they couldn't really categorize it as its own disease until they proved more about it. So again, like the identifying symptoms of Noonan syndrome are like you can see from the picture, like the broader neck, it's almost kind of like a webbing in the neck, and then low set ears and wide set eyes. And short stature is going to be something that happens later on in life. They're actually like an infant born with Noonan syndrome is going to be normal height, but as they develop further usually before puberty, their growth is slowing down as they age, which is kind of weird. But another is macrocephaly, which is a larger head, and then sternal abnormalities. So that's going to be like their chest either having kind of like a deep indent in it or it's poking out, something that they refer to as pigeon breast, where the like your sternum pokes out of your chest. And so there's three types of Noonan syndrome that you can categorize it into. These are kind of like the main types. You could go further and narrow it down even more, but these are the three main types that they identify it to. And so the first one's Noonan syndrome, and that's going to be the most common one, and that occurs in over 60%, or sorry, excuse me, 70% of Noonan syndrome is Noonan syndrome 1. And it's often referred to as male Turner syndrome due to its overlap of physical features that are common with each of the conditions. But the main difference between Turner syndrome and Noonan syndrome 1 is that only females can be affected by Turner syndrome, while both males and females can have Noonan syndrome 1, or any type of Noonan syndrome really. But so Noonan syndrome is known to affect both males and females, but with a wider range of impairments. And individuals with Noonan syndrome 1 are highly likely to have a heart defect, with around 90% developing cardiac problems at some point in their life. And the most common cardiac defect that they can occur is pulmonic stenosis, which is what Jacqueline Noonan was studying. And that is going to be characterized by inhibiting blood flow from the right ventricle to the pulmonary artery. And so stenosis really just means like the tightening of that ventricle. And so that causes a blockage and it gives irregular blood flow. And again, like we said, the chest poking in or out is another thing that's pairs with pulmonic stenosis. And the webbing of the neck is also something that's believed to be from pulmonary stenosis, but they haven't really officially paired those two together. And then, so Noonan syndrome 2 is going to have almost the same, pretty much the same exact set of defects and abnormalities. The only way it differs really is the pattern of inheritance. And Noonan syndrome 2, um, it's inherited in an autosomal recessive manner, whereas Noonan syndrome 1 is autosomal dominant. So that's why you see Noonan syndrome 2 much less often than Noonan syndrome 1. And so, and then there's neurofibromatosis Noonan syndrome, which is again the same as the first two, but accompanied by neurofibromatosis type 1 on top of the other symptoms. So the genetic cause wasn't really discovered until way after Jacqueline Noonan was doing her studies, and that happened in the 90s from a Dutch scientist named Bert. And so he's credited as the man who's discovering the location for the Noonan syndrome 1 gene, and that is on the large or Q arm of chromosome 12. And so he discovered this from a 1994 study of a large Dutch family that had numerous people affected by Noonan syndrome 1. And so research continues to further narrow down the location of the gene, but it's a start to know, which arm it's located on, which chromosome. Obviously, it can be more specified than that. So it's proposed to be located at 2q24. However, it's not confirmed yet. And so the most common inheritance pattern for Noonan syndrome 1 is autosomal dominant. And so affected individuals with one copy of the mutated gene are going to have a 50% chance to pass it on. And that's why it's so much more common than Noonan syndrome 2 or neurofibromatosis Noonan syndrome. And those two really, there's no studies so far on the location of where it is on a chromosome or like what else might affect it. So hopefully in the future they're gonna, have more studies on that. So some of the more minor symptoms for Noonan syndrome are gonna be like besides the cardiac abnormalities, which are the real fatal ones, are going to be lymphatic abnormalities, which usually results in lymphedema. And these abnormalities are usually atypical drainage and blockage in lymph glands. And that's going to arise typically from the back of the neck. And this is also another factor that has been suspected to attribute to the broad neck of individuals with Noonan syndrome, as well as the formation of like the abnormal formation of the eyes, ears, and nipples. Another abnormalities that are going to occur are circulatory problems, and that's going to be differences in the way that the blood coagulates in someone with Noonan syndrome. And so they often display abnormal bleeding and severe bruising. Another one is kidney problems, and these usually don't occur actually with the organ itself, but with the area surrounding it. And it's often there's a widening of the pelvic cavity, but this really doesn't pose a fatal risk, but it's something down the line that can be dangerous. And then there's atypical sexual development in males and females, but males usually exhibit a wider range of irregularities. And so, in approximately 60 to 75% of males with Noonan syndrome, one or both of the testes fail to descend into the scrotum, which usually happens before birth or during the first year of life. And so, this is going to give fertility problems for males down the road if it's not surgically fixed. And females, the only thing that really can happen with females is that it's a delay in puberty and other really minor issues, but fertility is never affected by Noonan syndrome for females. So some major symptoms are gonna be for Noonan syndrome are gonna be cardiac abnormalities, and they're present in about 50 to 80% of persons with Noonan syndrome. Pulmonary stenosis that we already talked about being the most common of the cardiac conditions that it can affect them. And another one that poses a big threat is atrial septal defect, and that is a hole in the septum between the upper and lower atria of the heart. Also, cardiac defects in Noonan syndrome have been attributed to abnormalities in the cardiac jelly and extracellular matrix in cardiac cells. So the diagnosis of Noonan syndrome is really a tricky thing, and that's kind of why it took 10 years from the first like hard evidence of Noonan syndrome to it being really named in the scientific community as its own unique disease, because there's really no definitive biochemical or molecular test yet that's able to diagnose Noonan syndrome. And there has been the recent like mapping and linkage analysis we talked to with the 12q chromosome, but the genes of the syndrome have not yet been cloned, so there's no definite answer to whether someone has Noonan syndrome. And this usually leads to the diagnosis coming from like clinical studying from a doctor of the skeletal makeup and the physical features and heart defects, things like that. And that's going to happen at early infancy is when it's going to be diagnosed. Another one is family history, because it's either autosomal dominant with Noonan syndrome 1 or autosomal recessive Noonan syndrome 2. Both ways are kind of easy to tell. So family history is going to be something that you look at for diagnosing it. And there are some prenatal ways to tell if you're like the fetus has Noonan syndrome, and that can be the presence of excessive amniotic fluid and abnormal cystic swelling on the lymph vessels in the neck area. Another thing contributing to the broad neck. And so, yeah, clinical evaluation is really the only way that it's going to be diagnosed. And it's just so challenging because Noonan syndrome is extremely similar to numerous other conditions, even besides Turner syndrome. So it's really often misdiagnosed, and especially with females, because only females can have Turner syndrome, it's often that females with Noonan syndrome are misdiagnosed as having Turner syndrome. And then a karyotype test is required to show that it's actually Noonan syndrome. There's also another disease called cardiofaciocutaneous syndrome, and it's so incredibly similar to Noonan syndrome that it's still being debated as to whether it's a separate disease or if it's the same thing. But like another case where Noonan syndrome neurofibromatosis or something like that, like a offshoot of the disease, not its own category. So treatment for Noonan syndrome is really going to just be specific to each individual and what major and minor abnormalities are happening on their body, like you could need a cardiologist, an endocrinologist, like, and a hematologist all in one, depending on, if you have problems pertaining to those fields. But really you're going to need a lot of specialist doctors to help make sure that everything is running correctly with a child with Noonan syndrome. And so there's going to be a high likelihood of heart defects, and those need to be monitored. And also, the clotting of blood is another dangerous thing attributing to the death of people with Noonan syndrome. It's going to need to be monitored, and usually, people with Noonan syndrome take medications similar to aspirin to achieve proper blood clotting. And so, developmental delays will occur more for males than females, and it's not really known why yet. But males are more likely to have mental problems associated with other symptoms. And so, a plan for alternative methods of early childhood education are typically going to be needed. But without really major cardiac abnormalities, it's really possible to live a long and happy life while maintaining the other minor symptoms. And with advancements in gene mapping continuing every day, hopefully one day they'll find out more about this really rare disease and understand the mechanisms of the condition better. Thank you, guys.